Special Operations Unit uncovered plans for an upcoming...
How do we maintain true readiness for our military medical providers, soldiers, nurses? War is hell, and there will be casualties. But when a soldier dies in battle, and that flag is passed over at graveside, and you said we did everything, I'm sorry, better be telling the truth. I think that this program is an attempt to make sure that that statement is said with genuineness, authenticity, honesty. My name is John Chavanis. I'm a trauma surgeon here at Cooper. I also am the chief military surgeon. I'm a colonel in the U.S. Army Reserve. I've deployed 6 times, 5 into combat zones as an Army trauma surgeon, and I've been able to kind of bring all that together here at Cooper. This is a real-life setting. We allow people who already have the training to hone their skills in a supervised yet realistic environment. It's real, it's not simulation. There's that's someone's mom in front of you, someone's daughter. But you also have guardian angels around you to help guide you to make sure you're doing the right thing. Our situation greatly mimics what you're going to see in a battlefield setting as far as the severity of the wounds. It may not be a blast wound, but a high-speed motor vehicle collision on the interstate into a bridge abutment with 4 patients in there, 4 victims, or a multiple shooting. Right now, we may see someone shot 8 times, 10 times, 12 times. Those do mimic battlefield wounds. So this gives the soldier stress inoculation that's going to happen in the battlefield. Cooper's this amazing place. There's just a handful of places like it in the country. Sees this type of intensity with these kind of resources. The climate of this place is one of collaboration. It's people want to work together for a single mission, which is helping stop the premature death or suffering of someone. That's what this place is all about. And this environment makes it a safe place to learn while still feeling the intensity of learning.
Yeah, I'm Kirby Gross. I'm a retired Army surgeon. My role here at Cooper is I'm an attending trauma surgeon. These sort of training programs are critical because we are good at those things we do frequently. The individuals who are assigned here to Cooper are ready to deploy. They've had a chance to not only improve their clinical skills, but also gain an understanding of leadership roles and leadership management, which are critically important in the deployed environment as well.
My name's Corey Terry. I manage the Special Operations Combat Medic clinical rotation in New Jersey. The program is approximately 9 months long. This clinical rotation is kind of like the capstone, the finishing school per se for the SOCM course. The biggest benefit to these clinical rotations is the confidence you gain. Confidence is key when they're deployed in austere and dangerous environments by themselves as a sole healthcare provider, that they know they can do this. 2006, 2007 timeframe, I was working in the theater hospital in Balad, Iraq. There was a lot of sectarian violence, so there was just a ton of shock trauma. We were getting 12 to 15 trauma patients per day and 12 to 15 follow-up surgeries per day. And what I realized was how key the reserve forces, who are physicians and surgeons in civilian trauma centers, was to that operation. Because they work in level 1 trauma centers, they deal with trauma on a daily basis. They were actually teaching the active duty surgical teams how to do certain surgeries or certain techniques. What the AMCT3 program has brought to the military is just that model, that readiness to deploy to any future conflict or theater of war. So when they get on the ground, it's not a steep learning curve because they practice it every day.
I'm part of the AMCT3 program, which is a partnership between civilian trauma centers and the Office of the Army Surgeon General. Every trauma that comes in, there's a level of anxiety, a level of stress amongst the whole team. But when you do it more often, you're more clear, level-headed, you're able to manage the patient, your heart rate's down more, and it makes it so it's much, much easier to do your job.
The AMCT3 program has definitely increased my confidence in my own abilities as a provider. Every patient I see, I translate in my mind, how would I do this in combat? And what it does is it allows me to immediately translate what I learned here and then try to apply it to my past experiences in combat and what I expect in future conflicts.
There's nothing more comforting when I go somewhere and someone says, oh, I trained with you, and I just went to a presentation, and the ranger who trained at Cooper, and he cared for a helicopter that went down with a Army trauma surgeon on it. And here he is talking about that at this presentation. And he looks over at Colonel Gross and I, and he says, oh, yeah, I went to Cooper with these guys. I mean, you can't write this stuff. I hope this grows because this concept works. It's efficient, it makes everybody better, and it augments the military health system. It's a force multiplier.